Hi everyone, it's me, Melanie, your IVF nurse, and this video is going to be about sperm. So some of the questions that I've gotten over the years and recently are usually regarding the partner, how often that they should be having sex during the cycle, how long to abstain before, say, an insemination or an IVF, egg retrieval. So I'm just going to address some of those questions quickly and not get too much into specifics, but at the start, when you do have your consultation with your physician, the doctor is going to ask questions about previous reproductive history. So things like if there were previous pregnancies, if those pregnancies were terminated, if there was a miscarriage involved, or if there is a live birth, because that will give some feedback to the doctor in terms of his reproductive history with regards to providing the sperm sample. If there's a history of no children and no pregnancies, then that may be, a small piece of the puzzle. Now, one of the things that the doctor will recommend is that a semen analysis be done. And with the semen analysis, what they're looking at is, in terms of sperm count, morphology, and motility. And in terms of the actual semen itself, you're looking at volume and pH. Now, if all of those test results with the semen analysis come back within normal ranges and the plan is to proceed with timed intercourse, then it's okay to be having sex every other day if that's what you want to be doing. I find a lot of the times people are surprised when clinics advise that they can have sex every other day. Sometimes people are under the misunderstanding that they don't have sex at all, except for when it's nearing ovulation, but you still can ejaculate or have sexual intercourse throughout the cycle. Usually it's recommended every couple of days or every 2 to 3 days, or we'll say every other day. Now, one of the things that when you're prepping for insemination is that the same rules apply, that if there is a reason that you should be doing an IUI or an insemination, they will still say that you can ejaculate or have sexual intercourse every other day. And then as you're nearing the time for the insemination, so if your body's not ovulating on its own and you require a trigger shot, so this can be something known as HCG or Ovidril or Pregno, what happens is that I find a lot of patients will come and ask, can they have sex, or when should they stop having sex? Because most clinics will recommend that there is a window of abstinence of about 2 to 4 days. Some clinics will say 2 to 5 days. So you do want to check with your nurses that are assisting you in cycle monitoring and addressing any questions you might have. The other thing is that when you're doing an IVF cycle, it's the same recommendation that you abstain 2 to 4 days or 2 to 5 days, depending on what your specific clinic recommends. Now, still during IVF, it is still recommended, if you want to have sex every other day. It's entirely up to you. A lot of the times people get focused on doing the injections and cycle monitoring visits, and they just think like, no, we're just gonna do it when we need to. But you want to make sure that you do follow your clinic's instructions in terms of times of abstinence. Sometimes when people do a semen analysis, at the time the analysis can be fine, all within normal parameters, and then on the day of egg retrieval there may be an issue with either producing the sample or that there is nothing in the sample, because maybe there's been some time lapse from the semen analysis and the actual time that the sample is required for, say, IVF or an insemination. So if there's anything that should happen in the time frame that you are trying to conceive, whether it's an injury to the groin, if you've been sick, anything that would concern you, that would make you think that your partner may have an issue with sperm on the day of the procedure, you want to reach out to your clinic and the nurses just to see if there's the possibility to have a frozen backup sperm sample, either for insemination or for the IVF cycle. Clinics will always say that fresh is best, but sometimes under pressure, we all understand that sometimes you just can't get a fresh sample. So it's always a good idea, if there's any concerns that there would be an issue on the day of egg retrieval or insemination, that you do contact your clinic in advance to arrange to freeze a sample, and they'll be able to give you all the guidelines and instructions in what to prepare in order to freeze a sample prior to IVF or an insemination cycle. Now, one of the things that I'm not going to get into, but in the event that there are sperm issues or male factor infertility, your doctor or nurses, they will start talking to you about possible methods that they are able to obtain sperm. So TISA, PISA, and MISA, those are all things that they can do to extract sperm. And then in the event that there is no sperm at all, then what happens is that the doctor will be discussing with you about possibly using a sperm donor. Now, sperm donors, they have to go through a certain criteria for testing in Canada. So they would discuss with you all of that. If you have a known sperm donor, there is a designated donor program that is available in Canada, which meets all of Canada's or Health Canada's requirements. That is something you want to speak to your clinic about if you've discussed with somebody about co-parenting, or if you have a known sperm donor. The other thing is that if you choose to do, say, an anonymous sperm donor, then all of the sperm banks that are available to you, you'd get the information from your clinic, and then you would reach out to that specific sperm bank and address any questions you have. Now, some clinics will do a little bit more hand-holding in terms of helping you to select the sperm sample, but sometimes what happens is that it's kind of left up to you to reach out to the sperm bank and go through the whole process with them and meet with them and discuss profiles or things that you're specifically looking for in a sperm donor. So there are options. I hope you found this information helpful. Please feel free to follow me on Instagram at YourIVFNurse. You can email me at yourivfnurse@gmail.com for general information about services. You can also go and check out my website at www.yourivfnurse.com. You can also comment down below or subscribe to my YouTube channel. Thanks for watching.